Please welcome the Academy's President, Dr. David W. Parke II.
This is the last time that I will have the privilege of speaking at this meeting to my fellow ophthalmologists as their president, and I appreciate your attention. I recently read several speeches by one of Atlanta's most illustrious citizens, a man with profound impact on our public policy and on our culture, Dr. Martin Luther King, Jr. I came to realize that much of his message had less to do with religion and racism than it did with transcendent human values, individual responsibility, and a hope for our collective future. Some of his words, spoken nearly half a century ago, are very applicable to the challenges that we face today, both as physician professionals and as citizens of a world in transition. One statement I find particularly compelling: where do we go from here? First, we must massively assert our dignity and worth. We must stand up and develop an unassailable and majestic sense of values. There is no doubt that where we go, our future will be heavily influenced by factors outside of our control. And now we face new administrations with new priorities and a global economy in crisis. Unless we act, both individually and as a profession, we will abrogate our future to those outside forces. As the first step, we must articulate a clear vision for our future, but knowing where we wish to go is insufficient. Dr. King adds something critical to the equation. First, we must massively assert our dignity and worth. We will not achieve our goals unless and until we understand our own professional dignity and community worth, and we massively assert them to society. Society has questioned the worth and the role of the physician, and sometimes very specifically challenged the value of the ophthalmologist. We have ourselves to blame for some of this, whether we focus on LASIK surgery, cataract surgery, or vitrectomy surgery. Some of us trivialize our surgical procedures, our skills, and their impact. This doesn't just minimize the procedures, it trivializes the competence of the professional, and ultimately it diminishes the economic value society assigns. It impairs the ability of those advocating the special and unique competency of our profession, and it may alter the perceptions in the mind of the public that major surgery is only minor. We as ophthalmologists are not necessarily brighter than other physicians, New York hedge fund analysts, or corporate attorneys. We don't have a monopoly on integrity or on dedication to our communities. But what we do have is a unique and critical duty to preserve sight where imperiled and to restore sight where impaired. Dr. King's third sentence warns that to achieve our goals, we must stand up and develop an unassailable and majestic sense of values. Think about that phrase. What are the values that we as physician professionals hold closest? Whatever they are, they should be unassailable and majestic. And why? Because if our values are to be compelling, they must have majesty of scope and of purpose. What about these? That we are committed to patient safety and quality care first, that we take personal responsibility for our patients' welfare, that we pledge to respect the dignity of the individual, that we will be effective stewards of our profession in the service of the public good. That's not a bad start. Great words, but what do they mean pragmatically? It does not mean just posting a mission or a vision statement on the office wall. For values to be unassailable, they must be values that we consistently define by action at every opportunity. Only then will these values survive the crucible of public scrutiny, and will we establish the foundation to lead our profession into the future. They will also provide the basis for our society to appropriately assess our capabilities. In the next several years, healthcare policymakers and politicians will debate the relative value of healthcare. Some of that debate will be in economic terms, some in operational terms, some in social terms. We can decry the process, or we can affirm a strong stand on behalf of our profession and our patients, led by these values. This is not only a mandate for the individual ophthalmologist, but also for our academy. For our arguments to be unassailable, they must be supported by a coordinated advocacy strategy, by an effective public interface, and by genuine data. But above all, it depends on us, and I mean all of us. For to quote Dr. King once again, in the end, we will remember not the words of our enemies, but the silence of our friends. So I close out this year as your president with a challenge to us all. As we face an evolving professional future, let us not minimize or trivialize, but massively assert our dignity and worth, and develop an unassailable and majestic sense of values. They are our roots as a profession, and they will serve us well in the courts of public opinion and policy development. Thousands of our colleagues already donate many hours of volunteer time in service to our ideals and to our profession. The future requires that we must all make similar commitments, or our efforts will be endangered. But we will win. As Dr. King said, when people get caught up with that which is right, and they are willing to sacrifice for it, there is no stopping point short of victory. I am proud to be a member of this academy and of our profession. Thank you all.